So hi everybody. We are continuing with the electrical impulses that are created within your heart. We discussed previously the three steps that are involved in creating the action potential within your um, non-contractile cells, and the three steps were pacemaker potential, which is relying on sodium influx. We have the depolarization part of the action potential, relying on calcium influx, number 2. And then the last step is repolarization that relies on potassium efflux or potassium leaving the cell. We also mentioned that within these non-contractile cells, these non-contractile cells are spread throughout the heart in very specific structures, creating a very specific patterns that allows the electrical impulses to spread throughout the heart. This pathway of the non-contractile cells throughout the heart is known as intrinsic conduction system. It starts with the SA node or sinoatrial node and ends with Purkinje fiber. So let's take a look at each of these structures. Sinoatrial node is located on the most superior aspect of your right atrium, which is right up here. This is your sinoatrial node. And this is known as the pacemaker of the heart, which is basically going to create about 75 electrical impulses per minute. And remember that electrical impulses of the non-contractile cells eventually leads to muscle contraction. That means each of these electrical impulses create one heartbeat. So in average, you have 75 electrical impulses, which means you have about 75 heartbeats per minute. These electrical impulses is known as sinus rhythm that should be seen in people with basically a healthy intrinsic conduction system. Now, impulses from the SA node is going to spread from the superior aspect of the right atrium down to the two atria, left and right, using the gap junctions, and then eventually reaches the next structure, which is known as the AV node. AV stands for atrioventricular. You can see it right here. It sits between the right atrium and the right ventricle, hence the name atrioventricular node. There is a very specific characteristics with the AV node. AV node has very small fiber diameter and also has very few gap junction. This is really important because that means that the electrical impulses from the SA node, when it reaches the AV node and wants to be passed from the AV node down to the next structure, it takes a little bit of a time, which is about 0.1 second. A little bit less than half the time is spent in the AV node. Now, why is this important? Connect the electrical impulse to muscle contraction. So when SA node is spreading through the atria, that means that the atria is going to contract. So the superior part of the heart is going to contract because you have the SA node basically creating the electrical impulses. That delay ensures that the atria is going to contract first, and it's going to push all the blood down to the ventricle. Now ventricles can contract much more efficiently. Well, ventricles can contract more efficiently because now they're filled with blood, so they can circulate blood more effectively. So this delay that you're seeing, about 0.1 second inside the AV node before sending the signal to the AV bundle, ensures that the atria has done with its contraction before ventricles contract. Note that if your SA node is not functioning properly, which means you don't have the proper sinus rhythm, your AV node can take over, but it only creates about 50 electrical impulses per minute, which means it's not going to be as strong as your SA node. So your heartbeat basically drops if your SA node is non-functional. Now, the signal from the AV node gets passed down to the next structure, which is passed through the superior region of the septum. So this is septum, this area in the middle in the pink is septum. So this is the superior region of the interventricular septum, creating your AV bundle or bundle of His. This structure is basically going to be spreading the signal to the rest of the right and left, and it continues to branch to the right and left bundle branches. Sorry, this is supposed to be number 4. I don't know what happened to it. So atrioventricular bundle branches into right and left bundle branches, which implies basically you're going to make sure that electrical impulses are spread through both the left side, left ventricle and right ventricle. Now at the end, you see really tiny branches of these non-contractile cells forming, creating a pattern or branching called subendocardial conducting network, also known as Purkinje fibers. So if you look at the picture, we had the AV node, we had the AV bundle or bundle of His, which branches to these 2 main branches you see right here, called the bundle branches for the right and left. And then you see this tiny branching spreading throughout the heart. Those would be your Purkinje fiber. Purkinje fibers are relatively small. They create a very intricate pattern within the ventricle to ensure that the electrical impulses is being passed through it. And basically, one thing that I do want you guys to understand is that Purkinje fiber also can contract on its, can create its own electrical impulses that can cause muscle contraction if all of the previous system fails. But the electrical impulse or the ability to create electrical impulse is much weaker compared to what we discussed earlier for SA node and AV node. So this is about 30 beats per minute or 30 electrical impulses per minute, which creates a heart rate of about 30 beats per minute. And if you kind of imagine, this is relatively low. It's less than half of a normal heartbeat. So it cannot basically ensure that blood is circulating properly. Another number to remember again, going from the SA node, all the way from the top portion of the heart, down through the AV node, AV bundle, bundle branches, and Purkinje fiber, takes about 0.22 seconds to allow these electrical impulses to spread through the heart. A couple of imbalances that you can see in relation to intrinsic conduction system. One is called the arrhythmias, which basically means an irregular rhythm of your heart. This is basically describing an uncoordinated atria and ventricular contraction because the electrical impulses between the atria and ventricles are not correlating with each other. Another scenario is called fibrillation, where you have very rapid, irregular contraction of the heart. In many cases, basically your heart becomes, in the case of a severe fibrillation, your heart muscles become useless because there is no coordination between your heart muscles. So every piece of your heart beats on its own accord, and as a result, it cannot create enough contractile force to pump blood out of the heart. The way they describe it is like you have a bag of worm. That's how your heart will feel. Instead of having that squeezing force to push blood out, it's like more of a flapping motion that basically doesn't circulate blood effectively. This is really important because in many cases, it doesn't allow enough blood to reach to your brain, causing brain death and eventual final individual dying as a result of lack of circulation. Relatively easy treatment is if the heart responds, you can defibrillate the heart, which basically means sending an electrical impulse through the heart to stop and reset all of your channels and prevent these kind of chaotic motions and electrical impulses from the heart. You allow the heart to reset itself, and you hope by resetting your heart, your SA node is going to take over and basically does this normal sinus rhythm and allows the heart to pump regularly. Another thing we're going to talk about is something called a heart block, something that is relatively common. It is when you have the impulses that are supposed to pass through the AV nodes are defective. So basically, the impulses from AV node is not being passed on forward. Now you could have something called a partial block, which means some of the rhythms is being passed down to the ventricles, but you could also have something called a total block, which means that there is a complete disconnect between the AV node and the ventricles. In the case of total block, ventricles are going to beat on their own rhythm using their own intrinsic conduction system. However, typically, again, these systems are much weaker, so they cannot adequately supply the blood to the tissue because there's no adequate circulation. The best treatment for individuals, if they have been identified with either partial or total heart block, is to place a pacemaker which makes sure that atria and ventricles have been coupled. So you will create a rhythm that is normal, allowing the SA node to pass the signal down to the AV node, AV bundle, and continuing down the heart. Something else that you do need to know is we keep talking about your heart and the intrinsic conduction system, which relies on the non-contractile cells, independent of your nervous system. However, as I mentioned previously, this does not imply that the heart is completely independent of the nervous system. The heartbeat is independent of the nervous system. Creating a heartbeat is independent. But how fast do you create those heartbeats are still controlled by your nervous system. Now, because this is outside the heart, we use the word extrinsic as an outside versus intrinsic, which means in the house. So heartbeat can be modified by the branches of the nervous system called the autonomic nervous system. And this system is located within the cardiac center in a part of the brain called medulla oblongata. So when you're thinking about the SA node, we have something called when we're thinking about your autonomic nervous system, we have something called cardioacceleratory center, which basically sends the signals down to your SA node and the AV node that forces the SA node and AV node to beat at a higher rate, causing the heartbeat to increase. This is relying on something called a sympathetic trunk. Sympathetic implies a response in your body called a fight or flight response. So sympathetic nervous system or trunk is basically a branch of your nervous system which is representing a fight or flight. In such a scenario, basically you're dealing with a very stressful situation, which means typically your body needs a higher circulation. So the way your heart deals with that is that it creates it sends a signal to two structures, both the SA node and the AV node, both to the SA node and AV node, and ensures that the heart muscles is going to contract faster. So your heart is your body is supplied with proper amount of oxygen. We also have the cardioinhibitory center. This is associated with the parasympathetic nervous system, which is also known as rest and digest. This is a scenario, or housekeeping. This is a scenario where your body doesn't really need to have a high heartbeat. You're either sleeping, relaxing, or in your food coma, quote unquote. You don't need a higher heartbeat. So in that scenario, you're relying on a main nerve called the vagus nerve to decrease your heart rate. How does it do that? It actually inhibits the SA node and AV node by lowering the number of heartbeats. So basically, when you relax, your parasympathetic nervous system slows down your heartbeat. And if you're in a stressful situation, such as a fight or flight, your sympathetic nervous system gets activated, increasing the SA node and AV node firing or electrical impulses, causing a higher heartbeat. Here is a description of what I'm describing. You can see on top. Sorry, let's start with the green line. Green one is representing your sympathetic nervous system, which is again targeting the SA node and the AV node. You see other branches, but they're not as efficient. But the most important target would be the SA node and AV node, causing the heart to increase the number of electrical impulses. The one that you see in blue represents your vagus nerve, which is part of the parasympathetic nervous system, and it causes a decrease in heart rate, again by targeting your SA node and the AV node. And that is it for this PowerPoint. The next PowerPoint we will be focusing on the electrical impulses created in your contractile cells of the heart, which leads to muscle contraction.